province's announcement to put more money in the pockets of frontline heroes is being met with criticism by some groups who say they're being sidelined. Ontario's paramedics, for instance, say they are at a loss as to why they aren't included on the list. And tonight, they are not the only ones speaking out and demanding better pay. When it comes to the fight against COVID-19, paramedics say they are as frontline as it gets, often entering uncontrolled settings, dangerous environments, and the first to respond to long-term care homes at the epicenter of the deadly virus in Ontario.
We just find it very frustrating when the Ford government talks about healthcare heroes and frontline workers that somehow paramedics are left out of that description and out of that list.
The province's list of frontline heroes is long and includes everyone from workers at long-term care homes to correctional officers and food service workers. They are all eligible for pandemic pay, a significant $4 an hour increase on top of existing wages, plus an additional $250 a month for those working more than 100 hours a month.
If they are going to acknowledge the people who have worked the front lines, then they should be acknowledging everybody. They shouldn't be leaving certain groups out.
Paramedics are not the only ones speaking out. Farm workers say they are among the most vulnerable groups excluded from income supports, and they're demanding the province extend the wage boost to include all farm workers in Ontario to protect the food supply chain.
I've been very clear about is that food security and ensuring that there is a steady food supply is an essential aspect. It's very essential during this time.
One line in the province's release has become particularly troublesome for some groups. Pandemic pay does not apply to management in frontline settings. We spoke with the in-house supervisor of an organization that provides care for people with developmental disabilities who works alongside the team providing care.
I'm not excused from being there, but I'm not being included in this pandemic pay because of my title. I was very upset. I felt marginalized that our contributions aren't being acknowledged.
In a late statement, the province says they are grateful for the tireless work of frontline healthcare workers, and they'll continue to stand behind them as they respond collectively to the outbreak. They say they are continuing to consult with healthcare partners to address questions and determine who might meet the criteria for pandemic pay. For City News, I'm Tina Yazdiani.